Coming up on the Get Lean, Eat Clean podcast.
You can say like the weight set point of someone will alter as they alter a country or the food that they're exposed to. So I have a lot of patients a few patients who maybe that when they move to America, they put on some weight. And then when they move back to London, they lose weight without, any effort.
Hello, and welcome to the Get Lean, Eat Clean podcast. I'm Brian Grin, and I'm here to give you actionable tips to get your body back to what it once was 5, 10, even 15 years ago. Each week, I'll give you an in-depth interview with a health expert from around the world to cut through the fluff and get you long-term sustainable results. This week, I interviewed bariatric surgeon and best-selling author of Why We Eat Too Much, Dr. Andrew Jenkinson. We discussed how to get your body weight set point down, what's wrong with calorie restriction, what is leptin resistance, the role insulin, stress, and sleep play in weight loss, and his one tip to get your body back to what it once was. Really enjoyed my interview with Dr. Jenkinson. I know you will too. Thanks so much for listening and enjoy the show. All right, welcome to the Get Lean, Eat Clean podcast. My name is Brian Grin, and I have Dr. Andrew Jenkinson to the show. Welcome.
Nice to be here, Brian.
Yeah, thanks for coming on all the way from London. And I'm excited to have you on and discuss your book. When did the book come out?
So it was published January 2020, the hardback, and then the paperback came out January 2021. And yeah, it's pretty good. It became Amazon and Sunday Times bestseller.
Excellent. And the title is Why We Eat Too Much. The New Science of Appetite. So we'll definitely dive into the book, but maybe before we get into the book, perhaps give individuals, I know you're a general surgeon, you specialize in bariatric and laparoscopic procedures, and perhaps how did you sort of go down this road and your interest in getting into surgery and for weight loss and diabetes and things like that?
So I was training up in general surgery. My the end of my training was laparoscopic or keyhole surgery, and it concentrated on upper GI, so basically the stomach. Did a lot of stomach cancer surgery. And then I sort of fell into the job because I'd already worked with a colleague who was doing bariatrics, and he knew me. And as normally happens, he said, look, we've got a vacancy, you want to come for the interview? So I ended up being a bariatric surgeon without really having any formal bariatric training, but this was what happened like 20 years ago. And yeah, he sort of taught me up, and I started doing gastric bypasses, gastric bands, sleeve hysterectomies. And yeah, suddenly my waiting room was full, probably 80% full of people suffering with quite severe obesity. And the rest of the sort of practice, gallbladder, hernia, whatever, was sort of diluted away a little bit. And this is when I started to form a real interest in the disease, which is obesity. Why would these people come to see me and ask me to take their stomach out or bypass their stomach? So quite extreme surgery.
Right.
When conventional wisdom is, well, why don't you just go on a diet and go to the gym?
Right.
So it got me thinking, as someone who's from a relatively slim family, so doesn't have any, subjective experience of, having to try and lose weight and things like that. It intrigued me why so many people had such difficulties. And the thing that really struck me was, this is sort of mentioned in the introduction to the book, the similarities in people's stories. There was no collusion between people. I saw hundreds and hundreds and hundreds of patients, and they would, all say, and they still do say to me today, yeah, I can lose weight on a diet, but I put it back on. And then I end up even heavier than before the diet started. And then a lot of them say, I think my metabolic rate is low. Don't think I burn as much as my roommate or flatmate because I don't eat as much, but I'm suffering with obesity and this guy's slim. Or a lot of them would say, I think it's in the family, I think it's in the genes. And again, looking at, them when they come in with the family, it's obviously there's something going on from a hereditary basis. So I just looked into all of these areas and started to get really intrigued by the whole area, by the whole sort of field of weight regulation and obesity. And that, stimulated the research for the book.
Yeah, and I'm curious, just as a bariatric surgeon, the people that came in and you did the surgery on, like, what is the success rate for them in the future, and to keep it off and to maintain, where they want to be as far as weight is concerned? Like, is it pretty successful with this surgery?
Yeah, I mean, basically, they need to be coached that this is going to reset their weight, and we'll talk about the weight set point where people's weight is set without surgical intervention or serious lifestyle changes. So with a bariatric intervention like a sleep hysterectomy or a gastric bypass, their weight will reset, for instance, from an average of 120 kilograms down to 75, 80 kilograms within a year. If they then add in relatively simple and healthy lifestyle changes, so eating your own home prepared foods, not snacking between meals, looking after yourself, sleeping, doing a little bit of exercise, all of these things, then their weight won't go back on. But a lot of surgeons don't. They just go for the operation. They say, okay, you're going to be cured. They still have bad habits, and particularly the sleep hysterectomy procedure, 15, 20% of people will put weight back on, and feel a bit disappointed.
Yeah, because I would imagine that that's the biggest obstacle, is changing those habits that they've had through decades probably. Just doing the surgery isn't enough. They need to follow up and make sure that they're changing making lifestyle changes.
This is actually, I've been commissioned by Penguin to write a second book, which is going to be called How to Eat, and then in brackets, and Still Lose Weight. And that is going to be concentrating on, how people can change their eating and lifestyle habits, how the brain works, the dopamine reward system, and, what processed and, highly processed and, slightly addictive food does to our brains and our behaviors. And sort of once we have that sort of understanding, being able to unpick it, So that's the basis of the second book. And I think this is what people, because the first book, the end part of the first book, section 3, concentrated on, what lifestyle and dietary changes were required. But, it's not just being able to read a book, it's being able to change habits, which is really important. So a lot of people know what they're supposed to be doing, but it's we're basically automatons. We're triggered by various environmental things, and half the time we don't think about what we're doing. So I find that whole sort of habit thing fascinating at the moment.
Yeah, right. Like these habits that we're unconsciously doing every day, and they just add up over time. And I always talk about, like, yeah, you can have all the great information in the world and read all the books, but if you don't have a burning desire or a reason why you want to do, lose weight or whatever, get stronger, if you don't have a reason why that's really driving you, then it's probably not going to be great. You're not going to have long-term sustainability of that.
Yeah, I mean, the first thing comes with, I think, understanding the issues. So understanding how your body and the environment works. And then obviously wanting to change, but it's more, you have to be more than want to change. You have to almost change because you're educated about what the hell's happening to your body. It's almost like you could do this thing successfully and still be 120 kilograms. If you cracked it in your head and you want to be that 80 kilogram person, through lifestyle changes or whatever, then you can be. But actually, I'm not. That's a bad example, going from 120 to 80, because that's the example of surgery. When you get to that level of obesity, you do have other issues like leptin resistance, which is explained in the first book. But yeah, you can certainly lose a good proportion of your weight with lifestyle habit changes.
Now, you talk about body set weight, and I remember reading a little bit. This was years ago. Dr. Jason Fung talks a lot about that as well. So you touch on body set weight a lot. And I was mentioning that Dr. Jason Fung, a while back, talked about body set weight and ways to reduce that. A lot of times that is brought on by genetics. But how can individuals it's like the internal body temperature, right? Like, how can they get their body set weight down to a place where they're more comfortable, where they want it to be?
So, I mean, the first thing is to understand in the book, we term it the weight set point. So every individual will have, this weight set point, that the part of the brain that controls our appetite and metabolism, i.e. how much energy we want to take in and how much energy we want to expand and how much energy we want to store. this is your weight set point. And it's sort of almost impossible to fight against that weight set point. So you can go to the gym and try and diet and whatever, or starve yourself, calorie restrict. But the further you get away from your weight set point, either up or down, actually, it's almost like a elasticated sort of spring. The further you get away, the bigger the pull back. And the weight set point, so the individual's weight set point is actually 75% determined by the genetics. So if you're from a family that suffer with weight problems, then, it's sort of preordained that you may suffer. But obviously you have to combine that genetic predisposition with probably a Western food environment where there is a lot of sugar, refined carbohydrate, and artificial, other foods, vegetable oils particularly, as mentioned in the book, which significantly affect the messaging within your brain, the hormonal, homeostasis of your weight set points. So basically we're talking about insulin, omega-3/6 ratio, cortisol levels, these sort of things. So the combination of your genetics and your environment determine your individual's weight set point. So if, for instance, you have, a propensity to be from a heavy family, but actually you're in an environment where there is no Western food trigger for that, obesity, you'll be okay. But as soon as you move to an environment where, it's a Western food and culture, you'll really struggle. And the worst thing you can do is then start calorie restricting, because you're then training your body to be metabolically really efficient. It's almost like saying, okay, we're in an environment where a famine comes along every 6 months, a severe famine, where you're on, 800 or 1,000 calories a day maximum. Sometimes you're starving yourself even more. Your body not only will have a very efficient basal metabolism, and basal metabolism is 70% of our total expended energy, but also it will want to store more fat as an insurance against further famines. So these people who, a lot of my patients are recurrent diets, they've dieted for decades. And the longer it goes on, the more difficult it gets, until the end of the road, they come to my clinic and say, look, I gave up, take my stomach out. I hear it's good. So that's the weight set point, okay? So we talk about genetics in combination with the environment. And the environment affects it, particularly with the food environment, with something called leptin resistance. So our body weight is normally controlled by this hormone called leptin. Leptin comes from our fat cells. So the more fat cells we have, the higher the leptin level in our blood. And it's almost like a signal to the hypothalamus, which is that part of the brain that controls your appetite and metabolism. The leptin level in your blood is the signal to the hypothalamus of how much energy you're carrying. Have you got 2 months supply, or have you got 2 weeks supply? Do we need to go looking for food, or are we okay for a while? Are we in an environment where, we keep having these famines every few months? Do we need to store a little bit more? So that leptin signal will tell, it's almost like the analogy in the book is it's like the gas tank meter, in your car. Leptin resistance comes about when the leptin level is high, but it's being blocked by two things. One is too much insulin. So the insulin and leptin, signal to the hypothalamus are the same. They use the same receptor. So if you have high levels of insulin, the leptin signal will not get through. So the level of leptin is high, but actually your hypothalamus can't see it. The second thing that happens is, as obesity is an inflammatory condition, releases something called TNF-alpha. This causes hypothalamic inflammation as well. Against that dulls the leptin signal. And the analogy in the book is you're driving along the highway, going back to the gas tank meter analogy, you're driving along the highway and your gas tank meter's hitting red. You think, oh God, I've got to stop, I'm going to run out of petrol. Panic, try and find the next petrol station. Start to fill up. When you fill up, you realize it's full. The problem is the gas tank meter making you feel as if it's empty. And this is what leptin resistance is. So full-blown obesity, when we see people who are double your size, treble your size, particularly in America, people are really struggling. This is the disease. So their hypothalamus can't see any leptin. It's seeing probably the same amount of leptin as if you lost, 10, 15 kilograms. It's actually seeing a really low amount of leptin because it's being blocked by inflammation and insulin. So these people who suffer with severe obesity, are absolutely ravenous all the time because their leptin level is perceived to be low. The hypothalamus thinks they're fading away, and they have an extremely low basal metabolism. They're again a response to perceived, fat deficiency and a lack of food. So the symptoms that we think, the characteristics that popular Western culture thinks cause obesity, i.e., being greedy and lazy, are actually symptoms of the disease obesity. The disease obesity causes you to be voraciously hungry, and because it's embarrassing to eat in public, all these people binge eat in private, and it also causes you to be really, really knackered. Add on that the fact that you're carrying around, like 200 pounds extra. It's like it's a very sad disease. It's not understood by many people, including most doctors.
So what would you say? You talk about calorie restriction. Obviously, a lot of people, especially in the States, believe in this in calories in, calories out approach. And there's some truth behind that to someone that's maybe metabolically healthy, but to someone who's not, and who's obese or couple hundred pounds or whatever it is, overweight, who has a sort of a wrecked metabolism, like you mentioned, calorie restriction can actually potentially wreck your metabolism even more. So what steps with that, and what would you say steps for that individual?
Calories in and calories out are the ultimate. Okay, so you can't argue the fact that if you can throw someone into a prison cell or a concentration camp, whatever, and calorie restrict them, force them onto a treadmill, whatever, they will lose weight. But when you're in a society where there is, we're not prisoners, we can rest up if we want to, or eat if there's food available. You're then relying on the messages coming from the hypothalamus, and you can fight against it for a while. You can try and calorie restrict to lose weight, but those signals will become stronger and stronger. And it's a little bit like trying to lose, 5 pounds in weight through not drinking water. You can probably do that after 2 or 3 days. You will become quite dehydrated, but you're not going to. That's not a way of losing weight, because everyone knows that again, the hypothalamus, the thirst control center, you're going to be you're going to be have a parching thirst. So, weight regulation from the from the fat storage point of view is the same. It's like you can't just starve your way out of it, because those signals coming from the hypothalamus are sometimes as powerful as, if you try to lose weight ridiculously by dehydrating yourself. So the ultimate thing is to try and alter the weight set point, and you can only do that if you understand what the weight set point is, and that sort of theory of actually borne out with a lot of scientific research of it being actually quite significantly due to insulin, but also inflammation, and a little bit to do with the omega-3/6 profile, which we may go on to later, essential fatty acids. We know, and you mentioned before we started this podcast, that you'd had some sort of discussions about ketogenic dieting and things like that. We know ketogenic diets work. And they work because they significantly reduce the average amount of insulin you have in your body. And if you're suffering with obesity, certainly that leptin gets seen by the hypothalamus. And it's sort of people easily will, if they're overweight, they will easily lose weight with ketogenic dieting. The problem is that it's really difficult to maintain a very low carbohydrate intake in our society. I sort of take my hat off and congratulate people who can do it long term, but not many people can. My book sort of suggests that a better way of doing it is to try and go lowish carb, try and get your carbohydrate levels, first understand, what the what carbohydrates are in various different foods, and then try and get your intake down to, I don't know, less than 100, then 80, then 60. See if you can do 60. I think keto is like 20 or 30, isn't it? But if you can get down and not have any side effects and be lowish carb, I think that's going to have a really beneficial effect on your insulin signaling, and it's going to let leptin be seen.
Yeah. I mean, like I mentioned to you, I had just had a friendly debate between sort of a low carb camp. You have a clinical keto approach where it's very low carb. And then now you're starting to see that, people aren't, the clinical keto approach was mainly for people with, seizures and things like that. And so sometimes long-term keto for some people can maybe even be harmful when it comes to hormones. And once they sort of get their weight back in order, then they maybe can titrate those carbs up a little bit more. But when you talk about carbs, I mean, it depends on which ones as well, right? They're not all created equal. But to someone that's not metabolically healthy, usually it's the things that they're eliminating, right? If they're getting their carbs from 300 grams a day to 100, a lot of times they're going to be eliminating the processed ones, you'd hope.
Exactly. Yeah, exactly.
Yeah.
I mean, I'd sort of shied away a bit from the glycemic index way of looking at the carbs in food, i.e. the speed that the carb goes into your blood in the book. And I introduced this thing of the glycemic load of a food. So, the total amount of carbohydrate that is in, for instance, a potato, a slice of bread, etc., to make people aware that I think that's how you can get your total carb load down. And by definition, your average insulin levels down over a 24-hour period or a long period of time.
And what else would you say, you talk about like metabolism, what are ways to maintain a healthy metabolism, but also lose weight? I know you mentioned carbs. Are there any other ways that we can do that?
Yeah, I mean, I think that the book doesn't really talk too much about exercise. It does mention it a bit. I mean, I sort of say, unless you have the time, you don't want to really be training like an Olympic athlete. You're probably going to injure yourself and you're going to balloon again, when you can't do like 50 miles a week. So I still think, and it's sort of just based on common sense. If you can do some vigorous activity for 30 minutes, 3 times a week, this is what I tell my patients, enough that you're like sweat so much you need to have a shower. That's gonna, force your metabolism up, because as you're losing weight, even if you're losing it because your weight set point's been decreased because you've changed the type of food that you eat, you're still going to get a natural decrease in your basal metabolism. But if you exercise regularly, you're going to like force that back up a bit. Mm-hmm. We know exercise is great, not really just for expending calories, but I think it's great because it improves insulin signaling. So if you do exercise regularly, your insulin works better and you don't need as much of it. And it decreases the amount of cortisol that you produce. And cortisol, again, is integral, as is explained in the book, in glucose and insulin signaling. So my perspective on the gym and exercise is, you think you're running off the calories, but probably you're going to put those calories back in the juice bar. What you're actually doing, and obviously gyms do work because otherwise there wouldn't be thousands of them around, things that are around work. But it's not because you're burning off those calories, particularly in the gym. It's actually because you're making yourself metabolically much fitter, so you don't need as much insulin and your cortisol levels are lower.
Yeah, I agree. I mean, the saying is, you can't outwork a bad diet. I think there's a lot of truth behind that, but the benefits of exercise and putting on muscle, obviously, like you said, you sort of have a better glucose tank, right? You're more insulin, you can become more insulin sensitive. And I also think too, one good habit can lead to other good habits, right? Like, you start working out and then you're like, well, maybe I should change some of the things that I eat, and because that'll make me feel better and I'll be able to perform better in the gym. So I do think that like one good habit can lead to other, and you can stack upon those habits.
I mean, one of the things that's introduced in the book is this explanation of how dynamic our metabolism is. So as I mentioned before, and a lot of people aren't really aware that the amount of energy you use before you move. So imagine just staying in bed all day and not actually even rolling over. So the amount of energy you use to heat your body, your heartbeat, the chemical reactions within your body, the digestion, the immune system, all of these reactions just to keep the body ticking over, breathing, things like that.
Right.
Take 70% of our total energy expenditure. Most of the rest is pottering around, walking to work, so that's sort of most of the rest. And then literally maybe a couple of percent, 2 or 3%, maybe 5% if you go to the gym is, active energy expenditure. So and that's 70% of our total, basal energy expenditure is very dynamic. It can expand or decrease. And one of the examples in the book, and it's been researched quite a lot, but it's just not really out there unless you actually want to look for it. And it's not taught in medical school. So we would say, and there's a lot of apps that want to calculate your basal metabolism. So you'll put in your age, your sex, your weight, whatever, and it will say, okay, your average basal metabolism is so it would be 1,600 kilocalories per day. If you want to lose weight, you've got to get down and start just taking in 2,000, whatever. What the book highlights is if you take a group of, for instance, a group of 10 people who look and, who look the same age, same sex, same weight, same BMI, and you look at the highest metabolizer versus the lowest metabolizer of those group of 10 people, the difference in their metabolisms is over 700 kilocalories per day, which is the same as a 10K run or a large 3-course meal. And so this is why, and we all know people who, they can eat rubbish and they never put weight on, because that's right. Because they're the guys who've got the 10K run just in their genes. That's like without going for a 10K run. Right. And you've got the other guys who have to go for a 10K run in order to maintain their weight. And that metabolic variability is very dynamic. And I looked into how, what is the mechanism from a physiological point of view, where we can, adapt our energy expenditure up and down. It tends to be, as we said before, if you're calorie restricted, you're going away from your weight set point, you're going to get that pullback, your basal metabolism is going to collapse. If, on the other hand, you're overeating, which is what most people do in Western society, actually, quite often, if we calculate how much weight the population should be putting on, it should be putting on a hell of a lot more than it actually is, because our bodies are pulling us back from, gaining too much weight too fast. So actually, most people are over metabolizing. And the mechanism is, and you will have heard of this, the fight or flight response, the sympathetic nervous system. You heard a little bit about that?
Sure.
So this is something where, if we're scared by, in the old days, like an animal or a lion, you're going to get freaked out.
Stress response. Yeah.
You'll start losing a lot of energy. You're going to be very, very strong. The glucose levels are going to be up. Right. And you're going to expend a lot of energy. You're going to be able to run. You're going to be able to think really fast and stuff like that. And that's a sympathetic activation. And then the parasympathetic activation. Parasympathetic activation is when you're just relaxed and chilled out and there's no threat and you're conserving energy. You can imagine just laying on the sofa, just your heart beats down, you're cold, whatever. There's quite a lot of evidence when they look at studies that have voluntarily starved people and they've lost 10% and then 20% of their weight, and overeating experience where they put on 10% and 20% of their weight. And those studies show that it is the autonomic nervous system, so the sympathetic or parasympathetic tone of someone that will change and alter, the metabolism upwards or downwards. So people who overeat have got increased sympathetic tone, and this is most people, which is a reason actually for most of the population in Western, but a lot of Western population suffering with high blood pressure. Um,
So
we know that when people,
I was just going to say, so
yeah,
you're saying,
side effect of over metabolizing. So everyone has an increase, who overeats in the West has an increased sympathetic tone because they're burning off more so that they don't put the weight on, so that they can maintain, the body's actually trying to maintain their weight set points at that level, despite them trying to overeat. And so a lot of people have an increased sympathetic tone. If you go to my bariatric clinic, if you get a patient who's not dieting, they're going to have high blood pressure, they're going to have fast heart rate, that sort of thing. They're going to be sweating all the time because the core temperature is high, but they're obviously responding to that. We know that the best treatment for high blood pressure is to calorie restrict someone. And so this sort of fits in. So these studies have really shown and highlighted the importance of what we thought was just due to a stress response. Actually, the probably more important function of that autonomic nervous system response is metabolic regulation and keeping us at a level of the weight that our hypothalamus wants us to be.
Hmm. So when you talk regarding a stress response, are you saying that people tend to overeat due to just being stressed? Are you...
No, I think they overeat. No.
Okay.
Well, obviously, the Western, societal stresses, work, family, whatever, cause increased cortisol, which will increase people's appetite and their weight. And that's something that's just, we know, it's similar to if you, almost like living in the West is almost like a proxy drug. So if I started treating you with steroids, I put you on prednisolone, you would in 6 months or 3 months be, a stone heavier. You try and fight it, but you'll just be a stone heavier, even if you're someone who's able to maintain your weight for a long time. The same thing happens with the Western sort of cortisol stress response. Some people are going to be quite sensitive to that increasing cortisol level, and that's going to be one of the causes of their obesity.
Right.
What was your question again?
No, I was just saying if you were trying to draw a line between stress and weight gain.
Overeating, yeah. The other thing we have is, we do have the food industry is, it wants to make a profit, it wants to sell food, it wants to make food delicious and addictive, and there are significant addictive elements in processed foods which will get you hooked, basically like a drug. So that's another cause of overeating.
Now you talk about
go into the triggering of habits by advertising.
The highly palatable processed foods. And I know you always mention the West, and you're in London. Are the food habits where you're at just as bad as they are, or they can be here in the West?
That's another interesting thing. So you can say the weight set point of someone will alter as they alter a country or their food that they're exposed to. So I have a few patients who maybe that when they move to America, they put on some weight, and then when they move back to London, they lose weight without any effort. When they move to UAE,
from a change in environment, right?
Yeah, just the quality of the food, and we have a big problem with obesity in the UK, but when you go to America, there's certainly a bigger problem. And then when you look at the type of food that's available to the population, you realize why. And then you got to bear in mind, we see a lot of fat people around or obese people around, but a lot of them many of them are hiding away.
Yeah. And you talk about 75% of it being genetic, 25% being environment. And, I guess to someone who is obese, can that be sort of a tough pill to swallow, I guess, like the fact that,
the human race and all animals are very heterogeneous. So they have, differences in their genetic makeup in order to help them survive changes in the environment. If we're in an environment where suddenly there was a food shortage, the people who have, the genes that have, efficient metabolisms, can store weight easily. These are the guys that would survive, a world catastrophe where there is not much food. Unfortunately, we're in the other extreme where there is far too much, not only calories available, but also the type of food that's going to cause these people to put weight on. I think you just have to understand that, you are prone to weight gain if you eat bad foods. And in a way, and I say this to patients, you can look at it as a positive in that that you have to eat healthily. You have to eat, mainly old-fashioned foods, meat, fish, vegetables.
Single ingredient foods. Right.
Do a bit of exercise. Compared to the guy who was naturally slim and might not eat very good and may not exercise. Actually, from a metabolic standpoint, he's not that healthy. He looks okay, but at least you're forced, if you want to be, a relatively normal weight, you're forced to be healthy. And sort of once they get that, it's not so bad. But I mean, the whole thing about obesity being 75% preordained is from twin and adoption studies. So these are many different studies throughout lots of different countries where they look at identical twins that have been adopted by different parents, different families at birth. So obviously they've got absolutely identical genetics. And they found that there was a 75% concordance with their weights. So if you're from a slim family, both offspring are going to be slim, even if one's brought up in an environment where there's bad food culture and not much exercise. They're still going to look like their sibling, which is sort of what you'd expect. I mean, they're going to have the same color eyes and they're going to be the same height, so you would expect they're probably going to be similar weight. Obviously, if one grows up in rural Africa and one grows up in New York, then they're going to be different because one's not going to be triggered. But if they're brought up in the same country where basically you are exposed to pretty much the same food, then they will be similar weight afterwards.
And I know you touch on in the book a little bit, maybe we can talk about it, is the omega-3 versus omega-6 fatty acids and how that could play a role in weight gain.
Yeah,
ratio.
Yeah, I mean, we know about ketogenic dieting, we know about the importance of insulin signaling, but I think the other major important factor that Western populations have become fat is this big change in our polyunsaturated fatty acid profile on our cells. So just to explain, polyunsaturated fatty acids or essential fatty acids are like fat vitamins. So we can't make them. We can make pretty much everything. We can make cholesterol. We can make lots of things, lots of different types of fats, but we can't make two types of fats, and one is omega-3 and one is omega-6. And as I said, they're like fat vitamins, but we don't really understand lipid metabolism very well yet. We don't understand it like we understand, vitamin, the importance of different vitamins and what they do. So this sort of area is, formative research at the moment. But we do know that the ratio of omega-3 to omega-6 on your cell, every single cell has got omega-3 and omega-6. It determines, one, how well insulin is going to enter into the cell, and two, the amount of inflammation around in the body. When you go, and the two types of fatty acids are included in two different types of foods. So omega-3 is included in basically anything green leaf, and anything that's eaten grass and green leaves and plankton.
Oily fish, right? Fatty fish, get high omega-3.
So anything. This is why fish got so much omega-3 in them, because they're non-farmed fish,
right?
So natural fish, sea fish, because they eat plankton.
That's a whole nother topic. All the farm fish and what they're eating.
And this is what, Well, there's two with the omega-3/6 profile as well.
Right.
Very importantly, because there is a big difference in the omega-3 profile of farm fish compared to non-farm fish, and it's the same with meat from cattle that have eaten grass rather than
corn, soy.
So the omega-6, on the other hand, is found in seeds. And we know that, foods that have a lot of omega-3, so going back to the good one is omega-3, they tend to oxidize really easily, so they go off. So you can imagine fish going off within 24 hours if it's left out. Anything that goes off basically probably has got quite a lot of omega-3 in it because it oxidizes. The omega-3 causes oxidization. But this is not good at all for, food that is being bought and sold by food manufacturers. They don't like food going off. They need food to be.
When you say food going off, you mean like getting bad, getting
sell by date. Okay. Going back. Yeah. So sell by date. Yeah. So there are two types of food that have omega-3 and omega-6. Omega-3 is the good one for our cells, and omega-6 is not so good. Omega-3 is in fresh foods, and omega-6 tends to be in processed foods. Omega-3 comes from any food, that is grown from a plant. Grass has got a lot of omega-3, leaves, anything sort of associated with chloroplasts. So plankton as well in the sea. So anything that eats plankton. So this is why fish have got high omega-3 levels, and this oil is really good for us. Omega-6 tends to be in seeds and nuts and that sort of thing. It's almost like a winter type food, but it's been used by the food industry to produce vegetable oils, so nut oils and vegetable oils, which we're sort of told is good for us, but actually when you look at the science, it's not so good. And food that, as I say, is fresh tends to go off, and it's not great for the food industry because they make great profits because it can't sit on the shelf for very long. Whereas food that can stay on the shelf for a year or 6 months or whatever tends to have all the omega-3 removed from it because otherwise it would oxidize, and a lot of omega-6 oils and stuff like that in there to preserve it. And we know that if people are exposed to a Western diet, the omega-3-6 ratio on their cells, because these two fatty acids play an essential part in insulin signaling on our cells, that ratio goes from, so the omega-3 to omega-6 ratio goes from between 1 to 1 and 1 to 4, not naturally, to when you are exposed to a Western diet, 1 to 20 to 1 to 30. So there's a massive dilution of the effect of omega-3 on every cell, in your body. And omega-3 facilitates insulin messaging, so you don't need as much of it, and also decreases inflammation. Whereas omega-6 interferes with insulin signaling, so you need more insulin, and also increases inflammation. So in an indirect way, it's almost like having a highly refined sugary diet, but actually it's because it makes your cells need more insulin because the insulin isn't functioning properly. So this is the reason that, from a when you look at the data of populations exposed to Western diets, they as soon as they're exposed to a Western diet, they have a problem, with obesity. And I think it's not just sugar and refined carbohydrates. I think it's the omega-3-6 profile as well, which is why, fast food, it doesn't have to have a load of sugar in, but if it's dripping with vegetable oil, it's going to have a really detrimental effect on your metabolism and increase your weight set point.
Yeah. And I know you talk, I think, a little bit in the book regarding, cooking your own food. And I always touch on that on this podcast because, you can control what's going in it, and you don't have to cook in these vegetable oils when obviously these vegetable oils get heated, they get oxidized, they can cause inflammation, as opposed to cooking in, I like to use ghee, but you cook in tallow, even,
Don't get me started on the saturated fat arguments. So there's a big section in the book on, how that, whole scare story of natural saturated fats in dairy products and, red meat causing, ultimately heart disease. It doesn't. If you have this, condition, familial hypercholesterolemia, 1 in 500 people have that, and you tend to really struggle, in your 40s, you're dying from heart attacks and things like that. You've got to avoid saturated fats. But if you don't have that, saturated fats are very neutral as far as omega-3-6 profile is concerned. They're not going to cause obesity. This is it's got a terrible name, fat. It doesn't make you fat. People think it does, but it doesn't. It's actually really good for you, and the developing people in the developing world, and the non-Western world, understand the nutritional value of saturated fat. This is why offal, the innards of an animal are prized so much more than the meat on an animal.
Right.
Because we instinctively know that this food is good for us. So yeah, all of those studies that looked into the relationship between saturated fat, cholesterol levels, and levels of heart disease are explained in the book, and they're unpicked. And that body of research is seriously flawed. And when the food scientists started to tell us, look, you've got to avoid saturated fat, we went into a diet of much more refined carbohydrates, and the whole population became obese. This was like in the early 80s. So yeah, big epidemiological muck up.
Yeah, and that's something that gets talked about a ton in the States. I think a lot of people are understanding this. That doesn't mean the food manufacturers necessarily are changing their ways, but that's why it comes down to if you.
This is the problem. Though. The problem is, that when something is so ingrained in a population, it's really difficult to get that out.
Right. Oh, I know.
And this really is ingrained. But when you go and have your juicy steak, that that's going to fur up your arteries, and this is how we think. This is how your cab driver is going to think. He's been hypnotized into this. But it's not true. It's really good for you.
Yeah. Now I know we're coming up on about an hour here, but I just wanted to ask you one last question that I ask all my guests. If you would give, and you've given we've gone through a lot of good tips, but if you were going to give one tip to, let's just say, a middle-aged individual that was looking to get their bodies back to what it once was, maybe 15, 20 years ago, what one tip would you give that individual?
Eat like you'd eat 100 years ago.
Yeah.
So natural, home-prepared foods, no takeaway, no processed foods, don't snack. People didn't used to snack. That's a new bad habit we got into. 2 meals or 3 meals a day,
Yeah. Like in the 70s, right? People would have 3 meals a day, and now it's 6, 7, 8 meals.
Yeah, exactly. We're just totally constantly topping up our insulin levels and making ourselves fat. Yeah.
I like that. Well, thank you so much for coming on. Your book, Why We Eat Too Much: The New Science of Appetite. I'll definitely put a link in the show notes for that. And is there a good place for people to follow any of your other things that you're doing, maybe when your new book comes out?
Yeah, I'm on Twitter, MR as in Mr. AD Jenkinson 1. So yeah, at MRAD Jenkinson 1.
Okay.
But I'm not very active on it, but I've got a lot of historical stuff that I put in there. So, and when the new book comes out, and yeah, whenever any translation comes out of this book, I put the cover on. It's been translated into 9 languages. So, yeah, all good. Yeah.
Excellent. Well, thank you so much for coming on the podcast. We got our times right. You being in London and me being in Chicago. So I appreciate all the knowledge, and thanks again for coming on.
Thanks, Brian. Brilliant. Thank you. Fantastic.
Thanks for listening to the Get Lean, Eat Clean podcast. I understand there are millions of other podcasts out there, and you've chosen to listen to mine, and I appreciate that. Check out the show notes at briangrin.com for everything that was mentioned in this episode. Feel free to subscribe to the podcast and share it with a friend or family member that's looking to get their body back to what it once was. Thanks again, and have a great day.